Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic. The posterior thigh muscles. The muscles in the posterior compartment of the thigh are collectively known as the hamstrings. They consist of the biceps femoris, semitendinosus and semimembranosus, which form prominent tendons medially and laterally at the back of the knee. As group, these muscles act to extend at the hip and flex at the knee. They are innervated by the sciatic nerve. In this video, we shall examine the anatomy of the muscles in the posterior thigh, their attachments, actions and clinical correlations. Muscles in the posterior compartment. The muscles located within the posterior compartment of the thigh are the biceps femoris, semitendinosus and semimembranosus. Note: the hamstring portion of the adductor magnus has a similar action to these muscles, but is located in the medial thigh. Biceps femoris. The biceps femoris has two heads, long head and short head, and is the most lateral of the muscles in the posterior thigh. The common tendon of the two heads can be felt laterally within the popliteal fossa, posterior knee region. Attachments. The long head originates from the ischial tuberosity of the pelvis. The short head originates from the linea aspera on posterior surface of the femur. Together, the heads form a tendon, which inserts into the head of the fibula. Actions. Main action is flexion at the knee. It also extends the thigh at the hip, and laterally rotates at the hip and knee. Innervation. Long head innervated by the tibial part of the sciatic nerve, whereas the short head is innervated by the common fibular part of the sciatic nerve. Semitendinosus. The semitendinosus is a largely tendinous muscle. It is situated on the medial aspect of the posterior thigh and superficial to the semimembranosus. Attachments. Originates from the ischial tuberosity of the pelvis and attaches to the medial surface of the tibia. Actions. Flexion of the leg at the knee joint. Extension of thigh at the hip. Medially rotates the thigh at the hip joint and the leg at the knee joint. Innervation. Tibial part of the sciatic nerve. Semimembranosus. The semimembranosus muscle is flattened and broad. It is located deep to the semitendinosus on the medial aspect of the posterior thigh. Attachments. Originates from the ischial tuberosity more superiorly than the origin of the semitendinosus and biceps femoris. Attaches to the medial tibial condyle. Actions. Flexion of the leg at the knee joint. Extension of thigh at the hip. Medially rotates the thigh at the hip joint and the leg at the knee joint. Innervation. Tibial part of the sciatic nerve. Clinical relevance. Hamstring avulsion fracture of the ischial tuberosity. An avulsion fracture occurs when a fragment of bone attached to a ligament or tendon gets pulled away from the main mass of the bone. The muscles of the posterior thigh all originate from the ischial tuberosity of the pelvis. In rare cases, predominantly adolescents, sudden and forceful contraction of the hamstrings can result in an avulsion fracture of the ischial tuberosity. Patients with this injury often experience a sudden pain in the posterior thigh, followed by an inability to walk. It can be associated with sciatic nerve damage. The nerve lies in close location and could be compressed by a displaced fragment of bone. Treatment of avulsion fractures of the ischial tuberosity can be conservative or surgical. Conservative. Rest, pain control and physiotherapy. Surgical. Open reduction and internal fixation, setting the fracture in the correct position and then fixing in place with metalwork. Now let's have a quiz. 1. Which of the following options most accurately describes the innervation of the short head of biceps femoris? Sciatic nerve. Tibial part of the sciatic nerve. Common fibular part of sciatic nerve. Femoral nerve. The correct answer is common fibular part of the sciatic nerve. 2. Which of the posterior thigh muscles is situated most laterally? Semitendinosus. Biceps femoris. Adductor magnus. Semimembranosus. The correct answer is biceps femoris. Thanks for watching. Like and subscribe to Anatomy Movement channel for more.